Before we begin, a quick disclosure. This podcast is sponsored by Innovative Hematology Incorporated, a leader in blood disorder care, education, and clinical research. Innovative Hematology may have direct or indirect financial relationships with some of the organizations, products, or companies discussed. Full disclosure and details can be found in the episode show notes. Welcome to We Bleed Too, where women's health meets real talk, real care, and real expertise. Hello, everyone, and welcome to We Bleed Too. My name is Magdalena Lewandowska, and I'm joined by Hilary Gaudreau and Janey VanLiew.
The unique thing about our podcast is that we have different perspectives from a hematologist, an obstetrician, and from a registered nurse. Are you tired, depressed, bruised easily? Iron deficiency is very common in women, especially during their reproductive years, due to heavy menstrual bleeding and also with the demands that pregnancy puts on the body. So with some of these patients, when we had the conference not too long ago, you had a patient who came up to you at the end and you had presented this wonderful presentation with a list of all the different signs that people would experience if their iron is low. And she said, basically, I've had all of these signs and nobody has even tested my iron. So tell us a little bit about the signs of how somebody would know or even be suspicious that maybe their iron's low or that something's wrong.
Oh, wow. Yeah, I could talk iron deficiency anemia all day long.
Let's iron it out.
Let's iron it out. I love it. I love it. I love it. Okay. It's such a common thing. This is another area in medicine where we haven't been great at understanding and defining things. Verbiage matters, right? Like the way that we say things, the way that we represent things, what's normal, what's not normal is really important. And in the case of iron deficiency anemia, I think it's just been so underrepresented. So first of all, like the idea of gender-based hemoglobin, which is what's accepted by most labs, meaning labs accept women as being, they call it normal when a woman's hemoglobin is lower than a man's. And what's interesting is that there's really no data to support that. It comes from this theory that because, men have testosterone, technically, it can stimulate more hemoglobin and hematocrit. But really, more likely scenario is the fact that because women have heavy menstrual bleeding, they end up having lower hemoglobins than men, which doesn't necessarily mean that that's okay. Okay. Because as it turns out, we all need the same amount of oxygen delivery to our tissues and to our brain and to other organs. Another caveat to that is the fact that ferritin and iron studies, which are the ways that we measure how much iron is in our bodies, how much is stored. The way I like to talk to my patients about iron deficiency and anemia is it's kind of like a tank of gas. And so iron, we have a buildup, we have a storage pool of iron inside our bodies. And then your body uses that storage in order to produce red blood cells. And in a state where we're not bleeding, you don't need to take in a lot of iron. You only need about 1 milligram a day. Unless, for example, you have blood loss from menstrual periods, or you're an athlete where you can also lose some blood in the gut, things like that. But this tank of gas, once you run out of iron completely, like if you lose enough red blood cells and you're either not taking enough in or you're not absorbing it really well, then you can become anemic, right? So that could become a lot more detrimental. And of course, with anemia, then you have less oxygen delivery to tissues and it can become very problematic. But even with people who are not anemic, iron deficiency can cause a lot of symptoms, right? So it can cause significant fatigue. It can cause difficulty concentrating and hair loss and, issues with skin and your mucosal surfaces. It can affect the way our liver functions. And for kids, it's been shown, it affects what we call cognitive function, which is their ability to concentrate and to do really well in school. So the more we learn about iron, the more we kind of understand that it goes beyond just looking pale or being anemic. It really has to do with the way people are in general. Like I've even had patients misdiagnosed with depression that with repletion of iron, their mood got significantly better. And now I'm not saying that this is a treatment for depression. Let me go on the record to say that it's a, very real and separate diagnosis. But when you think about, for example, women who postpartum develop mood disorders, right? Iron deficiency can really have a significantly detrimental effect.
Iron deficiency might generate symptoms that mimic other disorders.
Oh, absolutely. Yeah. We see that all the time.
May I ask you about the gas tank? So I think that traditionally we've been educated as healthcare providers to think of iron as the gas in the tank. And when it's low, we're only concerned about what might happen when it runs out, instead of thinking about it as just being low is a problem. We've always been maybe kind of taught that iron, it's all about iron's ability to make red blood cells. Iron itself doesn't get the spotlight, right?
It's true, but you wouldn't like run out of gas. Like you would want to put gas in your tank before the car actually stops.
Right. Attention shouldn't be given to the gas tank when it's sitting on empty or past empty.
Yes.
We should be theoretically driving around with a full tank at all times.
That's a really good point. I mean, so iron itself can have a significant impact in how people feel. So if you think about restless leg syndrome, or you think about so many other medical conditions that can mimic or can be exacerbated by iron deficiency. And we really want to pay attention and make sure that those levels are replete. Now, the question is, how do we even know? Like, how do we diagnose if somebody's iron deficient? And that brings us to another can of worms where we haven't even had normal ranges that have been standardized across the United States to tell us what a normal ferritin level is, which ferritin is a marker of how much iron is stored within our bodies. And kind of like certain other proteins, like in von Willebrand disease, how you can have a stress response that affects those levels. The same thing can happen with ferritin. It's not a perfect test, meaning there's some people who have autoimmune conditions or have other ongoing inflammatory or infectious things that are happening in their bodies, and that can actually falsely raise the ferritin. So really with the ferritin, nobody across the US has been in agreement with what a normal range is. And we're actually hopeful. There was a new document that was written by the National Bleeding Disorders Foundation's Medical and Scientific Advisory Council.
And I believe you're on that council?
I have the privilege of serving on that council. And, the goal is really to educate and to empower patients and physicians to understand and to disseminate this information. Our goal is that a normal ferritin level should be above 50 nanograms per milliliter, which would be a significant accomplishment. Okay. And this is specifically pertaining to people with bleeding disorders. Now, the normal range for ferritin across the nation varies widely, whereas I think most people agree that, the minimum should be above 30 to 50. There are some labs that include 6, for example, within its normal range, which is consistent with significant iron deficiency. And that's really problematic because patients get these lab results back and it looks normal. It's not highlighted in red. There's other things which could be actually normal that are highlighted in red, but that is not. And then their primary care doctor receives it and they think it's normal. And then there's significant undertreatment as a result of that.
It detracts from the buy-in. So I saw a patient recently whose ferritin level was, I believe, 18, and her doctor advised her to start an iron supplementation. But she said, I looked at my numbers and it's normal.
Mm-hmm.
So she didn't start the iron because she felt more comfortable looking at the arbitrary lab normals and responding in kind to those numbers, than listening to her doctor.
Wow. That's really tough because the problem is people can have so many symptoms with iron deficiency. It's the most common mineral deficiency in the world. So there's about 2 billion people who have anemia worldwide, and the vast majority of that is actually iron deficiency anemia. So when you think about like the loss of productivity, you think of like the symptoms that so many people experience. And a recent study showed that 40% of adolescents between the ages of like 12 and 21 are iron deficient. And how is that impacting, right, our ability to learn, our ability to participate and engage in our family obligation in school, right? Women are doing great in general in school, but then how much better could we be doing, right? If we actually corrected for the iron deficiency, mind blown, right?
Yes.
So that the MASAC recommendation that we had talked about, with the goal, ferritin being over 50 and getting away from gender-based hemoglobins and using 13 as a cutoff for everyone, hopefully that'll help with education and advocacy, and also with this empowerment for patients to be like, hey, I understand that my value, for example, is within the lab's normal range, but it's actually not normal. And here's an explanation why. Unfortunately, a lot of people kind of get, I don't want to say dismissed, but really that is kind of what happens for years and years and years. And, interestingly, not until they receive treatment for their iron deficiency anemia do they start to feel better. And that is significantly problematic because how much time are we wasting and how many years of productivity in someone's life?
And enjoyment. And fulfillment. I remember learning several years ago when attending one of the hematology conferences that a person with iron deficiency, iron deficiency itself can lend itself to heavier bleeding. Can you expound on that? Because we never really think of iron as a treatment for the symptom of bleeding. We think of it as a step that's necessary to replete the iron lost due to the bleeding.
Yeah.
But I found it fascinating and I was so happy to learn it, but disappointed that I hadn't known that for so long.
Yeah, we don't have randomized control trials. And in fact, that might be slightly unethical to kind of make some people more iron deficient than others and to measure the amount of bleeding that they have. But it is a finding that iron homeostasis is really important in terms of the body's ability to achieve hemostasis, to stop bleeding. But also, actually, there is some data also, and it's not great data. It's not like randomized control trials, but there are certain patient populations in whom iron deficiency can actually increase the risk of clotting. And the reason why is that you actually get an increase in stress response, that stress response we had talked about. So you actually get an elevation in von Willebrand factor and factor VIII activity. And so we see that, for example, in a medical condition called HHT, or hereditary hemorrhagic telangiectasia. The bottom line is, though, that iron is involved in so much more than we even fully understand. And making sure that those levels are replete are really important to ensuring someone's well-being and making sure, and it goes way beyond just the anemia itself.
I think about Benadryl and I find it so curious that it can mimic an allergic response.
So I always think it's interesting to give the adolescents that iron-rich diet list. There's no Doritos on the list, so I can promise you that.